We've all felt it in one way or another, burnout. It's no longer identified as just being exhausted with your job or the circumstances in your life. Now we are learning that burnout can have real mental and physical consequences. Dr. Karrar Ali is an emergency medicine physician at Chula Vista, and Dr. Dara Schwartz is a lead psychologist at Mesa Vista, and they are here with more on this specific topic. First of all, thank you both for joining us right here on the floor.
Thank you.
Thank you.
Dr. Schwartz, I'm going to begin with you on this. When you talk to your patients, what is burning them out?
Oh, what isn't burning them out is really the question these days. It's been a long haul, 20 plus months in this heightened fight or flight response, right? So work, school, parenting, just navigating and living in this unknown, uncharted time is burning them out.
And have you noticed a lot more people coming to you explaining the feeling of being burned out?
Absolutely. The hallmarks of burnout are emotional exhaustion, cynicism and detachment, and questioning your competence. And we're seeing that over and over again from patients.
And Dr. Ali, I want to bring you into the conversation as well, because as Dr. Schwartz just mentioned, yeah, there are some specific symptoms, but let's talk about physical symptoms of burnout, which can come in the form of feeling like you're having an anxiety or panic attack, among other things.
Yeah, and what's very difficult with that is that sometimes you can't tell if you're having a panic attack or a heart attack. So we're seeing symptoms with chest pain and shortness of breath and dizziness and weakness. And these are all potential manifestations of very bad disease, like heart attacks or strokes or aneurysms. And so we go through the emergency department and talk to them about and go and rule out all the potentially harmful or potentially dangerous diagnosis. But then when you start talking to these people and you realize, wow, their headache's going on for a while, their chest pain's been there, and it only started because they end up losing their job or they're worried about their kids going back to school and contracting COVID. So we're seeing a lot of these physical manifestations that look like they're very life-threatening, but certainly they're basically people who are telling us that, hey, you know what, we're really burnt out.
What should people do, doctor? And I want to first start with Dr. Ali on this specific question. If they're feeling burned out physically, what can they do in order to cope with the symptoms?
Well, a lot of it is just talk with your primary care physician or, mental health worker. I mean, we have a lot of resources in, what's, to give to people. However, if you do feel things like chest pain or trouble breathing, come to us and we'll sort of help you. And we'll try to, kind of weed out if there's any life-threatening conditions, but at least we can get you some help. And we have a really good program with Mesa Vista as an outpatient. We have a lot of other resources that we can give.
And that's pertaining to the physical part of feeling burned out. But Dr. Schwartz, I want to bring you back in here for our final question. If you're feeling burned out, what can they do for brain health in order to get through this time?
Absolutely. So first of all, I want to say if anyone is feeling suicidal or depressed or anxious to the point where they can't take care of themselves, we want you to call and get help. That's not a sign of weakness. It's a sign of courage. But if you are feeling burned out, that fatigue, that overwhelm, a few of the things that you can do. One, start to take back control. One of the reasons that we feel so burned out is because everything's coming at us. Remind yourself what you have control over in your life. You have control over your breath and your body. You have control over the activities you engage in. You have control over how many times you check your social media feed, right? Other things that we can do, have a balanced perspective. What are you going to say to your family and friends 20 years from now about the pandemic? Are you going to tell them it was the worst time ever? Or are you going to tell them about the way the medical community came together, the way that healthcare workers, essential workers, media reporters showed up in the face of danger to do their job, right? And tap into that common humanity. Yes, our experience in COVID has all been different, but the one thing that unifies us as a planet beyond San Diego is we've all been through this together. So common humanity, balanced perspective, take back control.
All right, I think you just sort of tapped on a few things that we should keep in mind as we're feeling that burnout feeling. I really appreciate both of you spending some time with us. I know this is a much broader topic, and I wish we had some more time to sort of dive deeper into it. But Dr. Ali and Dr. Dara Schwartz, do appreciate your time. Thank you.